क्या आप जानते हैं ज्यादा स्ट्रेस लेने पर कम उम्र में हेयर लॉस और हेयर थिनिंग की संभावना बढ़ जाती है।
जी मनी हेल्थ शो में आप सभी का बहुत बहुत स्वागत है। एक ऐसा शो जिसमें हम आपको देश भर के जाने माने स्पेशलिस्ट्स और एक्सपर्ट से रूबरू करवाते हैं ताकि आपको सही मेडिकल एडवाइस मिले। और आज जी मनी हेल्थ शो में हमारे साथ चेन्नई से जुड़ रहे हैं डॉक्टर विष्णु सुंदर, जो कि एक प्लास्टिक और हेयर ट्रांसप्लांट सर्जन है, एक जाना माना नाम है। और उसी के साथ साथ डायरेक्टर है फॉलिकल हेयर ट्रांसप्लांट एंड कॉस्मेटिक क्लिनिक, जो कि चेन्नई तमिलनाडु में है। डॉक्टर विष्णु सुंदर, आपका बहुत बहुत स्वागत है। वी वेलकम यू इन आवर जी मनी हेल्थ शो।
Thank you for having me.
So डॉक्टर, आज सिंस यू आर हेयर ट्रांसप्लांट सर्जन, हम बात करने वाले हैं बॉल्डनेस एंड हेयर फॉल के बारे में। एंड आजकल बॉल्डनेस एक मेजर कंसर्न है। अब गए वो जमाने की 30s या 40s में ये प्रॉब्लम होती थी, आजकल अर्ली 20s में भी देखने को मिल रही है। सो माय फर्स्ट क्वेश्चन इज कि हाउ इज हेयर फॉल डिफरेंट फ्रॉम बॉल्डनेस एंड इन क्लिनिकल टर्म्स आप बॉल्डनेस को कैसे डिफाइन करते हैं?
Hair fall is a routine process all of us go through in some point in our life. Every hair goes through a cycle of a growth and a fall. So when you just say hair fall, it is not something abnormal. But whereas baldness means there is complete loss or near thinning of the hair roots in particular areas of the scalp. Now it can be called as patterned or unpatterned. Unpatterned means there is hair follicles present everywhere in the scalp, but there is generalized thinning, meaning the density is generalizedly reduced. Whereas patterned hair loss means in particular areas there is absolutely loss of hair, in particular areas it is less. Like the most common thing is the male and the female pattern baldness we talk about. There is absolute loss of hair roots in the front portion, in the temporal area, in the back. Now this is baldness. That's how baldness differs from a routine hair fall.
ओके, सो सर, जो बॉल्ड पैचेस हैं तो वहां पर हेयर रीग्रोथ बिल्कुल पॉसिबल नहीं है?
No, that depends on what type of hair loss, what type of alopecia it is. Like I said, if it is a patterned hair loss and if there is already complete loss of hair in those particular patches, yes, regrowth is very, very difficult. We will have to bring in new hair roots only, and we have to look at how we are going to do it. Whereas if there is only a generalized reduction in density, in those places, those hair roots which are still in rest, which are not active, which are inactive, that can be reactivated with medications.
Dr. Vishnu, आप एक जाना माना नाम है, you're famous. So I want to know कि patients जब आपके पास आते हैं for baldness, किस उम्र में, मतलब सबसे छोटी कौन सी उम्र है जिसके patients आते हैं आपके पास?
I get patients as young as 19 years old who come to me for proper male pattern baldness. Nowadays, even school-going kids start to get hair fall and pattern baldness, and by the time they come, once they start college or when they're about to go into college, they come to us for treatment. So patients as young as 19 years, yes.
Okay, so you mentioned male pattern baldness. So please हमारे दर्शकों को आप ये बताइए, what are the types of male pattern baldness? कैसी दिखती है ये सब?
Okay, so there are many different types of classifying. The most common practical type we use to evaluate baldness clinically is called the Norwood staging. Now this has about 7 stages. The stage 1 is normal, what everybody have. The stage 7 is complete baldness. Now between this, the 2, 3, 4, 5, 6. 2 and 3 is only hair loss in the temporal region. Okay, but 2 is in front of the ear, 3 is behind the ear. The temporal line goes behind the ear, it's 3. In front of the ear, it's 2. 4 and 5 is where patients have a patch going in there and a small circle starting from behind also. So in 4, there is a big bridge of hair between that posterior patch and the anterior area. In 5, that patch becomes very narrow. 6 is when the circle behind and the temporal in front start to join with each other. And 7 is when the full baldness happens. So this is the clinically practical and easy way to remember what stage of baldness you are in.
ओके एंड सर, इफ अगर हेयर फॉल जो है उसका फर्स्ट स्टेज में हम ट्रीटमेंट करें तो क्या बॉल्डनेस से बचा जा सकता है?
Yes. But when you can prevent baldness, if you are genetically prone to get bald, invariably at one point in time you will get bald. But at least we can push it from 25 years to 45 years. So that makes a lot of difference, right?
हम वैसे कहते हैं सूनर द बेटर, बट इन बॉल्डनेस वी से जितना डिले हो उतना अच्छा है. ऑल्सो सर, आई वांट टू नो, आपके पास क्या लड़कियां, महिलाएं भी आती हैं बॉल्डनेस की शिकायत को लेके? क्या गंजेपन की समस्या उनको भी होने लगी है आजकल?
Yes, a lot of females come to, and nowadays the female pattern baldness is more common than before, and there are various reasons for that. Our diet is a reason. Our generalized lifestyle habits are reason. The hormone-related issues is a reason. So yes, we do get a lot of females compared to a few years ago with female pattern baldness or even diffuse baldness. No, I do. Yes.
And so, what are the types of female pattern baldness? आपने हमें मेल पैटर्न बताया कि यहाँ से बाल कम होने लगते हैं या यहाँ पे एक सर्कुलर बॉल्ड पैच बनने लगता है. So these are certain male pattern baldness patterns जो हम आइडेंटिफाई करते हैं. फीमेल्स कैसे ऑब्जर्व करें कि ये बॉल्डनेस की शुरुआत है?
In females, we mainly follow two types of clinical classification. One is called a Ludwig classification. One is called a Savin classification. Don't worry about the names. The first type is where there is hair loss predominantly involving this area.
Okay, this area.
So yes, in the front. Yeah, that is very common. Females usually get hair loss in this area. There is one line of hair which is around there like that. So that one line of thin hair is there, but behind that they start losing their hair. It is divided into 3 stages: mild, moderate, and severe. So, but the predominant hair loss is severe. The other Savin type is where the hair loss starts in the center line where women comb the hair like this, right?
Yeah.
So that line starts getting wider and wider with time, and eventually it becomes a big patch. This is called Savin stage. It is divided into 7 stages with starting from the smallest line to the biggest line.
And sir,
but these are the 2 main patterns.
Do women also suffer from receding hairline?
Yes, they do. We call them male pattern, female pattern because they are more common in male, more common in female. But females get male pattern baldness and males sometimes get female pattern baldness. It is possible. Yes.
So sir, now my question is कि problem तो हमें पता है, baldness है, और अब आपने जैसे बोला it's irreversible. Then how do we treat it? What are the treatment options? आपने बताया mild, severe, moderate है. Does the treatment varies? If you can tell everybody.
Yes, the treatment varies. Yes, and it predominantly depends on what time the patient presents and how much is the level of the hair fall already. If it is a early stage, the treatment is mainly depending on whether or not there are some hair roots which can be activated with treatment. So if in an early stage patient comes to us with hair roots which are still there in the scalp but are inactive, we can treat them with medication and prevent them from falling for some time. We can hold it in the scalp for some time. Okay. So a patient who would have become bald by 25 years can push it to 35-40 years with regular treatment. It is possible, but if they present to us at an early stage. Right. But when the patient comes to us, if the hair roots are already beyond the reactivating stage, then we will have to bring in new hair roots only. Then only the hair roots will start growing.
Okay.
Now coming to the stage where the hair roots are still in an inactive stage, they can be reactivated. We have different kinds of medications. We have medicines that can be applied on the scalp.
And what are the medicines, sir? If you can give us a brief.
Yes, I will do. So the medicines which are applied on the scalp, the most important medication is called minoxidil. The concentration varies depending on the patient and the sex of the patient. But this is the mainstay medication. This medicine has been used for the past many years in hair fall treatment. Has a very safe profile also. Not a lot of side effects. But still, but this is the most important medication that is a gold standard in treating hair fall. The next type of medication is what we take via mouth. So oral medication. So in this, there are there are medicines as such. This class of medicines are called as finasteride or finasteride derivatives. They have some side effect profile, so it is not advisable to take it without a doctor's advice, without a proper examination.
Also, sir, my last question is कि what are the in-clinic treatments for baldness and hair loss? और क्या hair transplant ही एक इकलौता option है?
Yes, apart from hair transplant, the in-clinic treatments mainly include injections, which are a combination or a variations of what are called as PRPs. PRP is platelet-rich plasma. So where the patient's own blood is taken and a particular part of the blood is separated and re-injected into the scalp. There are some differences in that now in the recent technology, the recent advances. There are more fortifications to this PRP formulation. The other thing which can be done in the clinic is what is called as mesotherapy, where we actually inject medications, not PRP, just medications directly into the scalp of the patient in the dermal layer. One more thing which we can do are called as derma rollers or micro needling. So where we use small needles to roll over the scalp and we cause micro injuries, and that when the small injuries heal back, they heal back with good skin, with good hair growing potential. So these are the main in-clinic treatments that the patients have to take, apart from the medications. But all these, they give the most use when all of them are used together. Like not one after the other. Yes. So we usually advise the patients to start minoxidil, start supplements, and also come for regular sessions of PRP or other medications or other in-clinic treatment as that are suitable for the patient.
Okay, so very informative. सबसे पहले तो एक अच्छे डॉक्टर से कंसल्ट करना बहुत जरूरी है सो दैट वो आपको एडवाइस कर पाएं कि आपको कौन सा ट्रीटमेंट जो है फॉलो करना है. एंड ऑन दैट नोट डॉक्टर विष्णु सुंदर, हम आपका थैंक यू कहना चाहते हैं पूरी जी मनी की टीम की तरफ से. आपने अपने बिजी स्केड्यूल से हमारे लिए टाइम निकाला. थैंक यू सो मच.
Thanks a lot for the opportunity. It was a pleasure talking. Thank you.
So ये थे डॉक्टर विष्णु सुंदर जिन्होंने आज हमें बताया अबाउट हेयर फॉल एंड बॉल्डनेस एंड ऑल्सो कौन कौन से ट्रीटमेंट्स आप कर सकते हैं. देखिए डॉक्टर की बात तो हम सब जानते ही हैं, लेकिन अगर थोड़ी सी नॉलेज हमें भी हो सो आई एम श्योर वो बहुत इंपॉर्टेंट होती है और सही सलाह आपको मिलती है जी मनी हेल्थ शो पे. ऑन दैट नोट मैं नेहा बजाज आपसे लेती हूँ इजाजत. मिलेंगे जी मनी हेल्थ शो के एक नए एपिसोड में विद अ न्यू सुपर स्पेशलिस्ट. टिल देन कीप वॉचिंग जी मनी हेल्थ शो, क्योंकि अच्छी सेहत हमारा वादा.